So somebody wanted to know about NAION related to disc drusen. And as you know, the small cup to disc ratio is the structural risk factor for non-arteritic anterior ischemic optic neuropathy. So when you have a cup to disc ratio that's less than 0.1 or even 0, you're more likely to get NAION. Presumably that's because a small amount of focal edema in a crowded small space can lead to an ischemic cycle where edema causes ischemia, ischemia causes more edema, and if it's in a tight space, you'll get ischemic optic neuropathy. And so when you have little rocks of calcium in your optic nerve, that makes the space even smaller. In addition, the optic nerve calcified drusen can press on the little tiny blood vessels, and so there are multiple ways that you could get to NAION from disc drusen. However, because this has no test to prove that the disc drusen causes NAION, you really have to work this up. And the problem is a lot of patients who have disc drusen are found when they're young. And so the most common cause of acute unilateral optic neuropathy in a 25-year-old is optic neuritis. And so we're going to have to use the MRI to adjudicate this question. You want to have MRI, head, orbit, gadolinium, and what we're looking for is gadolinium enhancement of the optic nerve. And 96% of the time, if you have optic neuritis, we're going to see enhancement. So if you don't see the enhancement and you don't see any white matter lesions for MS, now you still have to consider the other optic neuropathies, and normally that's MS, MS-like illnesses, and MS mimics. But if the person has disc drusen, you're going to be moving the diagnosis away from inflammatory and towards ischemic, even if this person is 25 and has no vasculopathic risk factor. You still have to test the person for the usual suspects: hypertension, diabetes, high cholesterol, the normal things. We might give them IOP lowering agent, glaucoma drop, but that's completely unproven. And it's a diagnosis of exclusion. So normally we're going to do ultrasound for calcified disc drusen. We're going to be making sure that the OCT shows that there's drusen. We're going to be looking with the fundus and taking a picture of it. And if everything is negative and there's no enhancement and the person has disc drusen and they have a field defect that doesn't get any better or maybe gets a little bit better, then you can make the diagnosis of NAION related to drusen.